So this is a big issue. So the overall survival for CMML patients is quite poor, only 3 years. And the average age of diagnosis is in the mid 70s. And so these patients are often not transplant candidates. What really drives a lot of the mortality is progression to acute myelomonocytic leukemia. And so, kind of figuring out what drives that progression from a chronic disease state to an acute leukemia is really a big focus, a big research focus of our laboratory. And then just kind of improving quality of life for these patients because it is really quite a distinct disease from MDS and it's been historically lumped in with MDS. And so focusing more on the myeloproliferative aspects of disease that are tied to symptom improvement.